Right, guys, so today we're gonna look at brachial plexus. The brachial plexus. Brachial plexus, it's the it involves the nervous system that will be supplying your upper limb, which means it's gonna have motor innervation to muscles, sensory cutaneous innervation to your skin, vasomotor actions to your blood vessels, secretomotor actions to your sweat glands, all those things. They are going to be supplied via this brachial plexus. Right, so your brachial plexus is going to come from the ventral rami of the spinal nerves of the upper uh, of C5 to T1 spinal nerves. This will be ventral rami, C5 to T1. So you can actually appreciate that we have C5 to T1 here. These will be coming from your spinal cord. The spinal nerve, they will divide into ventral and dorsal, and the ventral of the C5 and T1 are the ones that are going to intermingle and form the brachial plexus. The brachial plexus is going to be divided into five. You're going to have the roots, the trunks, the divisions, right, being in the posterior triangle of the neck. And then the cords and the terminal nerves, they are going to be right side in axilla. Very important, right? So your roots, your trunks, your divisions, they're going to be in triangular, your your posterior triangular portion of the neck, of the root of the neck, while it's your cords and the terminal nerves, they are going to be in your axilla, right? So facts about the brachial plexus that you should never forget, right? So, like I said, the first one is that the roots, the trunk, and the divisions are present in the posterior triangle of the neck, right? And no peripheral branches or nerves will originate from the divisions of the brachial plexus. So the brachial plexus will not give any branch, any nerve division, any nerve branch. You can actually see that they are in the trunks. You can actually see in the cords. You can actually see these branches, but in the divisions there are no branches. So you're going to have six divisions, right? Six divisions. Each trunk will be giving you an anterior and posterior, as we're going to see. Right. All the motor function can be tested by the movement of the thumb. So if you want to test the motor functions of the brachial plexus, they can all be tested by the movement of the thumb. Right. So let us get into it. Right. Let me zoom a little bit right here. Right. So you're going to have your roots, your trunks, your division, your cords, and your terminal nerve. So we said the roots, we have the anterior rami of your spinal nerves. So you're going to have your C5 to T1. So the C5 and the C6, they are going to join, and then they're going to form what you call a superior or upper trunk. The 7, the C7 is going to continue on its own to form the middle trunk. The C8 and T1 is going to join and form the inferior trunk. You understand? Before they join, you're going to have um, a branch of a nerve coming from the C5 root. That is called the dorsoscapular nerve. The dorsoscapular nerve, what it's going to do is going to come from C5, and then it's going to innervate your your elevator scapulae, your rhomboid minor, and your rhomboid major, right? Very important. And this nerve does not cross the axilla. The dorsoscapular nerve does not cross the axilla, right? So you're also going to have this long nerve that is called the long thoracic nerve that will be coming from your C5, your C6, and your C7. The long thoracic nerve is going to supply a muscle that is called the serratus anterior. And take note of this. This nerve, right, can be cut during a radial mastectomy, which is removal of breast cancer, right, and can result into what you call winged scapula. Winged scapula. Done. So we are now on the trunk. The superior trunk is the only trunk that gives branches of nerves. The middle and the inferior will not give. So what are the nerves that will come from the superior trunk? Right. The superior trunk, it will be coming from C5 to C6, is going to have the suprascapular nerve. The suprascapular nerve is going to go and innervate your supraspinatus and your infraspinatus. Your supraspinatus and your infraspinatus, they're going to be innervated by the suprascapular nerve. And take note of this. The suprascapular nerve is the nerve that will be passing within the foramen, the suprascapular foramen, right? And remember, the suprascapular artery will be above, right, the suprascapular transverse ligament. So the suprascapular nerve is the one that will be passing in the tunnel. Remember, the army moves over the bridge and the nerve under the bridge. Remember the mnemonic. Good. We are also going to have the nerve to the subclavius. The nerve to the subclavius, from the name, is going to supply what muscle? The subclavius muscle. The muscle that we said it originates from the junctions of the costal, the first costal cartilage and the rib, and is going to insert on the groove on the inferior aspect of the clavicle. Right? These are the nerves that are going to come from the superior trunk. The middle trunk and the inferior trunk, they don't give any nerves. Let's go to the divisions. So each trunk is going to have an anterior and a posterior division, an anterior and a posterior division, an anterior and a posterior division. Take note of this. These divisions, they don't give any nerve. There are going to be 6 divisions, and they are not going to give any branch of a nerve. The division, the trunk, and the roots, they lie in the posterior triangle of the root of the neck. You understand? Good. So the anterior division of the middle is going to join the anterior division of the superior or the upper and form the lateral cord. Then the anterior division of the inferior is going to continue as the medial cord. And as for the posterior cord, all the posterior divisions, they are going to join and form the posterior cord. Good. So what is important now is to know the branches of nerves that are given by each cord. Right. So in the axilla, so we can actually see the plexus of nerves right here. It looks very complicated, right? Good. So they will be coming from C5, ventral rami of C5, C6, C7, C8, and T1. Right? So you can actually appreciate the long thoracic nerve right here. You can see it, right? And then you can appreciate the nerve to the subclavius right here. That will be going to your subclavius muscle, right? You can appreciate the dorsal scapular nerve right here. That will be going to innervate the elevator scapulae, the rhomboid major and rhomboid minor, right? Very important. So what I want you to appreciate here is this. If we get to the axilla, I'm going to talk about the axilla artery being divided into three parts by what we call the what? The pectoralis minor. But the first part of the axillary artery, the cords, the cords, they're going to lie superior and lateral to the first part of the axillary artery. Very important. Right. So let's take a look at the branches of each cord. So the lateral cord is going to be called lateral because it's going to be lateral to the axilla, to the second part of the axilla. So this is your axillary artery, the second part of the axillary artery, and the names of the cords they are given or they are named according to their orientation on the relative to the axillary artery. So the cord that is lateral becomes the lateral cord and gives some branches. The one that is medial becomes a medial cord and gives some branches. And then the one that is posterior becomes your posterior cord that gives some branches. So take note of this, the posterior cord is larger than the lateral and the medial cord. Because remember, it has been formed by all the posterior divisions of all the trunks. You understand? Good. So, what is given by the lateral cord? The lateral cord, you use a mnemonic called Lucky Loves Me. Lucky Loves Me. So you're going to have one, the lateral pectoral nerve that is going to innervate your pectoralis major. You're also going to have the lateral root of the median nerve, this one, right? The lateral root of the median nerve. And then you're going to have your musculocutaneous nerve. So this your lateral cord is going to give your lateral pectoral nerve going to the pectoralis major muscle, the lateral median nerve, the lateral medial, the lateral root of the median nerve, and your musculocutaneous nerve. Right. So the musculocutaneous nerve becomes the termination of the lateral, the terminal branch or the terminal nerve of the lateral cord. Good. As for the posterior cord, the posterior cord, you have to use a mnemonic called ultra. U-L-T-R-A. Ultra. Right. Ultra, the U is going to be the upper subscapular nerve, which we call the superior subscapular nerve. So the upper subscapular nerve or the superior subscapular nerve is going to innervate the subscapularis muscle. The subscapularis muscle, right? And then you're going to have your L stands for the lower subscapular nerve or the inferior subscapular nerve. This is going to supply the subscapularis muscle and the teres major muscle. So this inferior subscapular nerve will supply two muscles, your teres major muscle and your subscapular muscle, right? And then the T is gonna stand for the thoracodorsal nerve. The thoracodorsal nerve is gonna be a superficial nerve that will descend downward, that will go downward, superficial, and is going to innervate your latissimus dorsi muscle. Right. And then we are left with the R and the A. So the R stands for the radial nerve. And the radial nerve is the largest terminal nerve of the brachial plexus, right? And it has all the roots C5 to T1, right? And you're also going to have the axillary nerve, right? So that will become your posterior cord. As for the medial cord, you use the mnemonic code most medical men uses morphine. Most medical men uses morphine. Right, so let's go with it. So you're going to have the medial, the first M, the medial pectoral nerve. The medial pectoral nerve, it supplies the pectoralis minor and the pectoralis major. So the pectoralis major is going to have dual innervation from the lateral pectoral nerve and the medial pectoral nerve. You're also going to have the medial cutaneous nerve of the arm. The medial cutaneous nerve of the arm is going to supply the skin of the medial aspect of your upper limb, together with your lateral cutaneous branch of the second thoracic nerve, forming what called the costal brachial nerve that will supply the medial portion of the arm. That's your medial cutaneous nerve of the arm. And then the other M stands for the medial cutaneous nerve of the forearm, right? That's gonna supply the medial portion of your forearm. The lateral portion of the forearm is gonna be supplied with the lateral cutaneous nerve of the forearm, which is a continuation of the muscular cutaneous nerve, right? And then the ulnar nerve is gonna be the terminal nerve for the medial cord. For the medial cord, right? So this is very important for you to understand the relations of the brachial plexus relative to the axillary artery. So we say the first part, right? The axillary artery is going to be divided into three parts by what you call the there's going to be a muscle called, let me look for it. All right, a muscle that's called the pectoralis minor that will be originating from the upper 3, 4, 5, right? And it sits on the coracoid process. It's going to divide into three, the axillary artery. So the relations of the cord with the first part, they are superior and lateral to the first part, and then to the second part, which is behind the pectoralis minor, they are going to be named relative to their orientation to the second part, right? Right, so let me just get into some clinical correlates of the, the brachial plexus, right? Right. So you can have lesion of the upper trunk that will result into what you call policeman tip or elbow palsy or a waiter's tip, right? Waiter's tip, policeman tip, or elb's palsy, right? Very important. So this is going to result in the hand medially rotated, the elbow extended, and your hand is gonna be pronated, right? That's your elbow palsy, right? You're also going to have a lesion of the lower trunk. So injury of the lower trunk is going to lead to what you call Klumpke's lesion. Klumpke's lesion. Very important, right? Uh-huh. And then lesion of the posterior cord, which is mainly the lesion of the radial nerve, is going to lead to what you call wrist drop, right? And then lesion of the thoraco of the lateral thoracic nerve, like I said in radial mastectomy, which is the removal of breast cancer, is gonna lead to wing scapula. So that's everything for today about the brachial plexus. Follow into our next lecture as we move with the causes of the musculocutaneous, the median nerve, the radial nerve, and the ulnar nerve, as well as the muscles that they innervate. Stay tuned.